The mission of the Department of Occupational Therapy is the preparation of excellent, innovative, adaptive, responsible occupational therapists who will become the professional leaders for the Commonwealth, for the nation in the years to come. The clinical component is a major portion of our program, and we start right from the very beginning with students being involved in level 1 field work, and even before that with some service learning opportunities. So they get out to area daycare centers, even in the fall when they're studying typical development. But they start their level 1 field work in the spring of their first year, and then they have 2 more level 1 field works in their fall and their spring of their second year before they start their 2 3-month-long field works. So they have 6 months of field work that finishes up their program. And we couldn't do the work that we do if we didn't have absolutely fabulous clinical educators that are out in the field. And we work very closely with them on a regular basis, both from a teaching standpoint and also from a research standpoint. We have strong clinical linkages throughout the community. And the students have opportunities to go to area hospitals, skilled nursing facilities, schools. This semester in my class, they're out at 9 different facilities for mental health around the entire community for their 3rd level 1 field work.
One opportunity we had this past year to partner with the Children's Museum of Richmond. One of our faculty led an initiative there where we the first semester went in and assessed the different exhibits offered at the Children's Museum in terms of their universal accessibility for children with disabilities, whether it be physical disabilities or cognitive disabilities, etc. The second semester, our program got to help out by making some adaptive projects for the Children's Museum. So that was anything from creating a universally accessible art easel for children with different abilities to use to making some modifications for communication with these different exhibits. So we felt like we really got to contribute in a real way for that project.
And just another example of that, OT is so versatile. We do one service project through our student organization for occupational therapy where we help with what's called Rebuilding Together, and we go inside the community and we help do home modifications. And that's one thing we're qualified to do and we learn about. So it's a nice way for us to help the community and give back to the community and also teach other people what occupational therapy can do.
And that's a prime example of how we collaborate with another discipline because we partner with physical therapy on that day to go in to really get a good, thorough assessment of what that client needs from our standpoint and theirs so we better understand our professions and meet the needs of a client.
And we have a centennial vision for the profession, that the profession will be widely known, recognized as a scientifically driven and evidence-based practice that has practitioners that are connected globally and that have a very diverse workforce. So for that reason, our mission supports the mission of the profession as well as the mission of the school and of the university for diversity and for evidence-based, research-based practice.